we'll continue with the topic jaundice. So in the previous video I was dealing with types of jaundice, in which I had dealt with physiological jaundice. So physiological jaundice, it is a normal response of the baby to excrete bilirubin, to excrete limited effect to excrete bilirubin. So normally this usually occurs in term babies between 30 to 72 hours, and in case of preterm babies it usually occurs before 30 hours, but not below 24 hours. So this usually it is usually about this physiological jaundice. So next we saw regarding breast milk jaundice. So it occurs in 2% of the infant breastfeed babies, and it usually occurs due to low caloric intake as well as due to dehydration. So next we started with that jaundice due to hemolysis. Okay, jaundice from hemolysis. So jaundice from hemolysis may occur due to breakdown of red cells due to hemolytic diseases. Okay, so jaundice occurs due to breakdown of the RBCs due to hemolytic diseases. Okay, due to hemolytic disease of the newborn. Okay, due to hemolytic disease of the newborn. So that is usually what happens. So in this mainly it occurs due to breakdown of the RBCs. Okay, breakdown of the RBCs in the due to hemolytic diseases. Okay, due to hemolytic diseases, that is usually seen in the newborn. Okay, that is usually in the newborn. So that is mainly in this. So they will be having either too many red RBCs. Okay, they will be having either too many RBCs or bleeding might occur. Okay, they might be having too many RBCs or bleeding can occur. So that is usually about this jaundice from hemolysis. So jaundice from hemolysis, it mainly occurs due to breakdown of RBCs due to hemolytic diseases. Okay, breakdown of RBCs due to hemolytic diseases of newborn, that is RH disease, and this is having too many RBCs or bleeding. Okay, too many RBCs or bleeding. So that is usually about this jaundice from hemolysis. So next is jaundice related to inadequate liver function. Okay, jaundice related to inadequate liver function. Okay, jaundice due to inadequate liver function. So this is mainly occur due to inadequate liver function, that is due to any infection or any other factors. It usually occurs due to any infection or any other factor. So where liver will not be able to function properly. So in that case, this type of jaundice occurs. Okay, when the liver is not able to function properly, so in that case usually this jaundice occurs. Okay, so that is usually about this jaundice related to inadequate liver function. Okay, jaundice related to inadequate liver function. So that is usually done. So next is due to effect of disease. Okay, so next is due to effect of disease. So this is usually occurs low level of bilirubin. It's not a concern. Okay, low level of bilirubin, it is not a concern, but it can circulate in the tissues. But large amount of bilirubin is required, can circulate to the tissues in the brain. Okay, so large amount can circulate through the tissues in the brain and may cause seizures and brain damage. Okay, and may cause seizures and brain damage. So therefore, this condition is usually called as kernicterus. So this condition is usually called as kernicterus. So that is effect of disease. Although low level of bilirubin is not a concern. Okay, low level of bilirubin is not a concern, but a large amount of bilirubin can enter into the tissues of the brain and can cause seizures and brain damage. So this condition is usually known as kernicterus. Okay, this condition is usually known as kernicterus. Okay, so this is usually about this types of jaundice. So types of jaundice, they are mainly physiological jaundice, breast milk jaundice, jaundice due to hemolysis, and then jaundice due to inadequate liver function, and in case of other diseases. Okay, so this is mainly other diseases mainly occurs when there is large amount of bilirubin, when it enters into brain tissues as well, and it causes brain damage or it might cause seizures. So that is usually known as kernicterus. Okay, this is usually about the different types of jaundice. So next is causes. So causes of jaundice, it might be due to if the baby is suffering from hepatitis, or in case of physiological jaundice in neonates. Okay, in case of physiological jaundice in neonates, so that is usually there. And next, in case of hemolytic jaundice, it mainly occurs when there is ABO and RH incompatibility. So physiological jaundice, hepatitis, or if they are having hemolytic jaundice, this usually is caused due to if the baby is suffering from ABO incompatibility and RH incompatibility, or if there is mismatched blood transfusion. Okay, if there is mismatched blood transfusion, so that is usually about this. So causes, it might be like in case it can be due to hepatitis, or it can be due to physiological jaundice, or in case it can be due to hemolytic jaundice. So in case of hemolytic jaundice, it is usually occurring due to ABO incompatibility or RH incompatibility, or in case of mismatched blood transfusion, or in case of mismatched blood transfusion. So that is usually there. Next, in case of if the baby is suffering from cholecystitis, okay, in case of this, if the baby is suffering from cholecystitis, that usually causes obstructive jaundice, okay, that usually causes obstructive jaundice. Cholecystitis is nothing but inflammation of the gallbladder, so that is usually there. And next is in case of if the baby, like if they are suffering from cirrhosis of liver, and if there is obstruction of obstruction in the bile duct to gallstone, like obstruction of bile duct by gallstone. So that is usually about this causes of jaundice. So mainly it includes in case of physiological jaundice in neonates, if it is like baby suffering from hepatitis, or the baby suffering from hemolytic jaundice, that is due to ABO incompatibility or RH incompatibility, or mismatched blood transfusion, if there is mismatched blood transfusion. Next, in case of cirrhosis of liver, then if there is any obstruction in the bile ducts due to gallstone, or in case of cholecystitis where it leads to obstructive jaundice. So this is usually about this causes of jaundice. So next is signs and symptoms of jaundice. So what are the signs and symptoms of jaundice? Mainly it is yellowish discoloration. Okay, there will be yellowish discoloration in the baby skin, which starts from face and then moves down to the body. Because in introduction I have told you that jaundice usually occurs from top to bottom. Okay, jaundice usually occurs from top to bottom. So therefore, it starts yellowish discoloration will be there from the face, and then it moves to the down. So that is usually then they will be having poor feeding, or the baby might be lethargic, poor feeding, dark urine as well as dark stools. So the baby passes dark urine as well as dark stools. So that is usually due to the increased level of bilirubin. Okay, due to the increased excretion of bilirubin in the urine and stools, that usually leads to dark urine and dark stools. So that is by bilirubin will be excreted more. Okay, bilirubin will be excreted more. So due to this, the color will be changing. That is dark urine and dark stools. So these are usually the signs and symptoms of jaundice. So signs and symptoms, mainly there will be yellowish discoloration. It usually starts from the face and then moves to the bottom. Then there will be dark urine, dark stools, and also there will be poor feeding as well as lethargic. So this is usually the signs and symptoms of jaundice. So next is diagnostic evaluation. So what are the diagnostic tests that we have to do in order to confirm jaundice? It is that mainly we have to first assess for RBC count. Okay, we have to first assess for RBC count. Then we have to check for the RH incompatibility. Okay, then we have to check for the RH incompatibility. Physical examination should be done. So physical examination where we can assess like yellow discoloration can be identified. So physical examination should be done. Stool examination should be done. So stool examination is also done to check out the color of the stools, or if there is excess amount of bilirubin in that. So that has to be done. Liver function test has to be done, because if liver is not functioning properly, then also there is chances that the bile can increase, bilirubin level can increase, and it can lead to jaundice. So that is usually there. And then ultrasonography and radiology test has to be done. Okay, ultrasonography and radiology examination should be done. So this is done mainly to detect if there is any intestinal obstruction. If there is any intestinal obstruction, if there is any intestinal obstruction, because if it is not allowing the bile to excrete, if it is not allowing the bile to excrete, and the bile has been stored in the liver itself, like excess amount of bile it has been stored. So therefore that time it can cause this jaundice. So therefore we have to go with radiology and ultrasonography to mainly to check for presence of any intestinal obstruction. So this is usually about this diagnostic diagnostic test that we have to do in case of jaundice. So mainly it includes physical examination, RBC count has to be assessed, RH incompatibility should be checked. Then we have to go with stool examination, liver function test has to be done, and then we have to go with radiology and ultrasonography. Radiology and ultrasonography, it is mainly done to detect if there is any intestinal obstruction. Okay, to detect if there is any intestinal obstruction. So this is usually about this diagnostic examination, diagnosis test that we go in order to confirm jaundice. So next is management. So what are the things that we have to go with this management? It is that first it is mainly phototherapy. So first management that we go with it for treating this jaundice, it is phototherapy. So phototherapy, it is done mainly if the bilirubin level is between 10 to 12 mg per dl. Okay, phototherapy it is started when the bilirubin level is between 10 to 12 mg per dl. So this is usually what happens. So that has to be done. So phototherapy, it is usually done. So the bilirubin level, it is mainly between 10 to 12 mg per dl. So that is mainly done, and this is used like throughout the full day. Okay, from morning to night, the baby should be placed in the phototherapy, and then every 2 hours once the baby should be fed. Okay, every 2 hours once the baby should be fed. And while using this phototherapy, the baby's eyes should be covered and diapers should be worn, so that delicate parts are not harmed by the light. So that is usually about this phototherapy. And then we have to check for the bilirubin level. Okay, after that we have to assess for the bilirubin level in the blood test. Then we can just then we can stop this phototherapy. So first management that we go with, that is jaundice, it is mainly phototherapy. So phototherapy, it is given mainly when the bilirubin level is between 10 to 12 mg per dl. So that is usually done, and the baby should be placed in the phototherapy machine from morning to night, and every 2 hours once the baby should be breastfed. And then bilirubin level should be assessed. Eyes and the eyes should be protected, as well as the vaginal area also. Eyes should be protected, and the diaper should be worn to the baby. So we have to protect both the areas. And then blood level of the bilirubin should be assessed. So that is usually about this phototherapy. So next is use of fiber optic blanket. Okay, then we can use fiber optic blanket. So this is also another form of phototherapy. Okay, this is also another form of phototherapy, that is fiber optic blanket. It is usually another type of phototherapy. So this blanket is placed under the baby. Okay, this blanket is placed under the baby. So that is usually, this can be used alone, or it can be used with a combination of phototherapy. Okay, this fiber optic blanket can be used alone, or it can be used with a combination of phototherapy. So fiber optic blanket. So fiber optic blanket, it is usually another form of phototherapy, where the blanket will be placed under the baby. So this can be used alone, or it can be used along with phototherapy. Okay, it can be used along with phototherapy. And next is exchange transfusion. So exchange transfusion, if the bilirubin, it's done only when the bilirubin level is above 20 mg per dl. Okay, so exchange transfusion is done when the bilirubin level it is above 20 mg per dl. So then blood transfusion is done. Okay, then blood transfusion is done. So this exchange transfusion is done to remove the baby's damaged blood with fresh blood. Okay, so that is in this exchange transfusion, the baby's damaged blood, it is removed with, and it is replaced with fresh blood. Okay, it is replaced with fresh blood. So this helps in increasing RBC count and lowering the level of bilirubin. This helps in increasing the RBC count and then lowers the bilirubin level. Okay, it lowers the bilirubin level. So that is usually about this thing. Then exchange transfusion is required when the bilirubin level is not reduced and it is increasing still. Then again exchange transfusion has to be done. Okay, again then exchange transfusion has to be done. So next treatment that we go with is exchange transfusion. If the bilirubin level is above 20 mg per dl, we go with this exchange transfusion, and this is usually done. Blood transfusion is done. So what is done? The damaged blood, it is removed and it is replaced with fresh blood, and then it is mainly done to increase the RBC level so that we can decrease the bilirubin level. And if the after this also, if the bilirubin level is after this also the bilirubin level it is not decreasing, then again we can go with this exchange transfusion. Okay, again we can go with this exchange transfusion. So that is usually done. So next is discontinued breastfeeding. Okay, we have to discontinue breastfeeding. So this is usually done in case of if the baby is suffering from breast milk jaundice. So breastfeeding should not be discontinued unless the baby is suffering from breast milk jaundice. Okay, the breastfeeding should not be discontinued, and it should be discontinued only when the baby is suffering from breast milk jaundice. Okay, the baby is suffering from breast milk jaundice. So it is continuously not stopped. It is stopped only for 1 or 2 days. Okay, it is not continuously stopped. It is stopped only for 1 or 2 days. Then we have, and like stopping this breastfeeding, we have to go with giving them equal amount of milk formula should be given. Okay, equal amount of milk formula should be given. Then after checking the bilirubin level, again we have to start with breastfeeding. Okay, again we have to start with breastfeeding. So this is usually about the management of management of jaundice, where we go with phototherapy. Phototherapy is given when the baby bilirubin level is 10 to 12 mg per dl. Then we go with fiber optic blanket. Fiber optic blanket is the other form of phototherapy, where the blanket will be placed under the baby. Then exchange transfusion is done. Exchange transfusion is done when the baby's bilirubin level is above 20 mg per dl, where the damaged blood, it has been replaced with fresh blood. Then we go with discontinuing of the breastfeeding, and this discontinuing of the breastfeeding will be done only when the baby is suffering from breast milk jaundice, and this is not discontinued fully but only for 1 or 2 days, and due to this we have to go giving them milk formulas. After the checking the bilirubin level, again we have to start with breastfeeding. So this is usually about this management of jaundice. So in this class we studied about jaundice. So jaundice, it is nothing but inflammation of the, jaundice is nothing but yellowish discoloration of the skin and mucous membrane.